The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to HDSA's Caregivers Corner webinar series. Today we are pleased to welcome Dr. Sandra Kostick, Dr. Deb Kegelmeyer, and Dr. Ann Klus, who are going to discuss functional evaluation and treatment for gait and balance. Before I invite them to begin, I would like to take a moment to review how you can ask a question, as well as how to access this webinar, as well as to tell you a little bit about our esteemed presenters. So to ask a question, you can ask a question at any time, but we will be answering all of the questions after the presentation has been completed. To send a question, just go to your control panel on the right-hand side of your screen and type your question into the panel and just hit send. You'll also be able to view this webinar again approximately 1 week after broadcast by going to the HDSA national website, www.hdsa.org. To access the presentation, go to the right-hand side of the homepage where you will see the frequently used shortcuts section. In this section, which is on the right-hand side of the screen, you will see a link to the Caregivers Corner webinar series. Older webinars are archived in the Living with HD section under Caregivers Corners. And now I am extremely excited to welcome our presenters on. Just to tell you a little bit more, Dr. Kostick is the director of the HDSA Center of Excellence at Ohio State University, where she's been the director for 11 years. Dr. Kostick's research focuses on neurodegenerative disorders, neuroprotection, and neurorecovery, particularly related to Huntington's disease, Parkinson's disease, and spinal cord injury. Dr. Kostick received her MD and PhD from the University of Chicago, where she focused her PhD research on control of motor circuitry. After completing her doctorate, she completed her residency in neurology at the Massachusetts General Hospital, which is an affiliate of Harvard University. After her residency, she was awarded a Physician Scientist Award from the National Institute of Medicine, where she focused her research on neurotropic growth factors in the nervous system. Deb Kegelmeyer has over 25 years of clinical experience and is currently an Associate Professor of Clinical Allied Medicine at Ohio State University. She has extensive clinical experience, having worked in acute care, outpatient therapy, as well as having spent 10 years as the Director of Physical Therapy at Wexner Heritage House. Currently, she works as a consultant at the Movement Disorder Clinic at Ohio State University Medical Center. She studies mobility and fall prevention in the elderly and those with Huntington's disease. Dr. Kegelmeyer is also the recipient of the geriatric section of the American Physical Therapy Association Research Award. Dr. Ann Klus is an Associate Professor of Clinical Allied Medicine at The Ohio State University. Dr. Klus is known for her work in the areas of balance and fall prevention in individuals with neurodegenerative diseases. She has lectured and published on the topic of assessments and interventions to improve functional mobility and prevent falls in individuals with ALS, Parkinson's disease, and Huntington's disease. Dr. Klus is a board-certified neurologic clinical specialist and was the former chair of the American Physical Therapy Association Degenerative Diseases Special Interest Group. She has been working with individuals with neurodegenerative diseases since 1993 and currently consults in the Ohio State University Movement Disorder Clinic. And now I am pleased to welcome our presenters.
Good afternoon. My name is Sandra Kostick, and I'm going to be starting out this presentation. As you heard, we're kind of going to do this as a team. So I'll start first. I'll talk a little bit about Huntington's disease and balance and gait issues from a neurological perspective, and then I'll turn over the speaker to Dr. Kegelmeyer, and then Dr. Klus will conclude our presentation today. The information we present today is for your information. As in any educational experience, you need to discuss the advice or recommendations or things that you hear with your primary care providers, neurologists, or other healthcare providers before pursuing these recommendations or things that we talk about. Huntington's disease causes both physical and mental symptoms that can contribute to difficulty with balance and walking. These balance and walking problems tend to worsen over time, and they can interfere with daily life activities, they can increase the risk of falls, and can reduce the overall quality of life. Maintaining balance is a complex process that involves the brain's ability to process multiple forms of information from multiple sources, and then it needs to coordinate all this information to coordinate movement. So for example, the brain needs to know where the body is starting from. Is an individual sitting, standing? What are they doing? Are they standing on an uneven surface? Are they trying to do multiple tasks, like work on a unicycle and carry groceries or their lunch pail or their briefcase? Are they going downstairs? Are they trying to balance on an unusual surface? Is their body in good tone? Have they exercised? Are they able to do and respond to changes in the environment? And what is going on at the moment? Is an individual hurrying, rushing to accomplish a task in an unusual environment, or stressed and not able to process all their information? So all these different features or factors can contribute to the brain's deciding what motor command it needs to make to keep an individual upright and to maintain balance and coordination. So the brain needs to take all this information from the environment, whether it's something that an individual sees or feels, and it processes information from the motor cortex, which is a strip in the top of the brain, and then sends that information down to the motor neurons and then to the muscle to decide on a movement. Two key areas of the brain that are essential for helping in coordination that the brain also needs information of from are the basal ganglia, which include the caudate and the globus pallidus. And one of the problems with Huntington's disease is that this center, which is essential for coordinating movements, is one of the first areas of the brain that is affected by Huntington's disease. So individuals with Huntington's disease may have abnormal function in this region, so that inadequate information is transferred from the basal ganglia up to the motor cortex. Now, another region of the brain which is involved in coordination of movements is the cerebellum. In general, the cerebellum, which is a structure at the back of an individual's brain, is not seriously affected by Huntington's disease. However, the cerebellum, as the rest of the brain, can be affected by some of the medicines that we use to treat some of the symptoms for Huntington's disease. And the cerebellum itself is particularly sensitive to the effects of agents such as alcohol, so that using alcohol may decrease the function of the cerebellum, and when you lose both the cerebellar and basal ganglia function, it can increase fall risk. So we have to take all these things into consideration when we are considering what contributes to maintaining balance and coordination. So falls increase over time in Huntington's disease as the disease progresses and as more and more brain processes are impaired. And as I mentioned in the beginning, we need to use a lot of different parts of our brain to coordinate movements. So over time, different problems may contribute to the increased likelihood that someone will fall. And one of the problems with treating Huntington's disease disease is that these problems may change over time and that you may need different strategies to prevent and decrease falls. So at the beginning of the disease process, people tend not to fall. But there's a certain point where there's a threshold where all the different problems kind of come together and the chance of falling increases. Now, normally this risk of falling just sort of progresses slowly over time, but there are some things that may worsen or increase the risk of falling. For instance, in some patients or some individuals with Huntington's disease, but not all, their chorea may be so extreme or so wild that it may throw people off balance, may contribute to balance problems, so they may fall earlier than somebody or have an increased fall risk earlier than somebody who has little, if any, chorea. In another individual, they may have more cognitive difficulties, so they make bad judgments about doing things, doing multiple things at the same time, or not able to cope with moving in a hurry, and so their cognitive function or dysfunction may contribute to their fall risk. And then other things that may occur, for instance, later in the disease, sometimes people develop spasticity or dystonia and abnormal fixed movements that can interfere with normal balance activities. So there are a lot of things we have to try and intervene with and be alerted to as the disease progresses to try and decrease the risk of an individual falling. So now, with that as sort of a background, I'm going to switch over the speaker to Dr. Kegelmeyer, who's going to talk a little bit more about balance problems in Huntington's disease.
Okay, hello. Balance problems in Huntington's disease are definitely lead to falls and increases as the disease progresses. Some of the things that we see more sway when people are standing still and doing daily activities. So their body will move back and forth more. Also, we see a slowed recovery response when they have a loss of balance. So they aren't able to catch themselves as fast, and sometimes that results in them being unable to actually catch themselves. We also see difficulty with what we call tandem standing and walking, or the ability to stand in a narrow base with one foot in front of the other, or to walk with one foot in front of the other like you're walking on a balance beam. When walking, these problems show up in slower walking speed, so they tend to move slower than people of their same age. They take shorter steps, and they tend to put their feet wider apart. And you can see that in this picture here, that the gentleman has a little bit wider stance or base of support than you typically see. And that is not all bad, because widening the feet apart gives a wider base of support and may actually help to deal with the balance problems associated with Huntington's disease. We also see uneven stepping. And what we mean by that is that one step doesn't look just like the step before or after it. So they may be short, then long, or have variability in the stepping. And that's problematic because research has shown that that variable or uneven stepping indicates an increased risk of falling. We also see a veering of the walking path. So the people may not be able to walk in a straight line. They tend to go side to side more often and have to make a lot of path correction. These are charts that show a normal walking pattern up here on the top, and we can see nice even stepping, and we see that the individual walking here went in a very straight line, and that every step is about the exact same length as the step before. And in a typical Huntington's patient, we can see here that the person started up at this end of the carpeting that they're walking on and veered down to the bottom, or had what we call that uneven path or path deviation. We also see more uneven stepping. So we see a short little step here, we see a longer step here, and we see this angulation as we try to draw lines from the steps. So a more uneven, not consistent walking pattern. And because of these problems with balance and walking, we see more falls in Huntington's disease. And it's very common to have falls, and most of them tend to occur in the home. Things that people who have Huntington's disease report about their falls, they say they may happen because of obstacles on the floor. Perhaps there were toys from their children on the floor. It might be a throw rug that tripped them up, or even small decorative pieces of furniture or vases or things like that. They also report that slippery surfaces can be quite challenging, and uneven surfaces, things like the slope of grass going down to a mailbox or gravel, rocky surfaces. And some of them report that they had dizziness immediately prior to their fall. Other things that happen with falling is that we know that they often occur when individuals with Huntington's are doing more than one task at a time. So maybe they're trying to walk and talk or have a conversation. And it is ideal not to engage individuals with Huntington's disease in conversation while walking, as they probably need to focus on their walking. The ability to do two things at once is basically run through the basal ganglia, and that's why they have trouble with these things. The other thing that can be very challenging is if they're trying to carry something while they're walking. In our clinic, we often recommend that individuals carry a bag so they can put it over their shoulder and put things in that, or use a backpack, or if they're really challenged and they're wanting to move things like cups or dishes, they could use a small rolling tray. But anything to keep them from having to maneuver things in their hands and carry them while walking. Climbing stairs is also difficult, particularly going downstairs. This can be a very dangerous fall to occur, and really safety measures should be taken. Some of the things that we recommend involve making sure that there's a rail or a banister that goes all the way down the stairs, at least on one side. Encourage your family member to go slow and to be careful. Tell them not to carry anything while walking on the stairs. Many individuals complain to me that they need to do laundry, so we may recommend that they put the laundry in a bag and go ahead and let it roll down the stairs ahead of them, and then they can walk down the stairs. If you have a family member that's impulsive or doesn't really realize or remember that it's dangerous for them to be on stairs, some families have gone so far as to close the door to the basement or put in a bolt lock or something to kind of keep the person from going there without thinking about it. Other times when falls occur when people try to turn quickly, and especially, again, if they're carrying something. When someone tries to suddenly change direction, maybe they were going to the left and they suddenly try to go to the right. And wearing unsupportive footwear, things that aren't very easy to walk on, high heels, sandals, slip-ons like flip-flops, and worn footwear, footwear that's not in good condition, can all contribute to falls. Exercise is a great way to prevent falls. Regular exercise helps to reduce balance problems and walking problems, and we believe strongly that the research shows it helps prevent falls. Exercise programs should be started as early as possible. It is much easier to prevent problems with walking and balance than it is to fix them later on. So we should all be exercising, and certainly anyone at risk for Huntington's disease would be well advised to take up a good exercise program. If you're wondering what to do, physical therapists can prescribe exercise programs that will help people with Huntington's disease to stay active and to move through the stages of the disease most ideally. In pre-symptomatic or early stage Huntington's disease, people are usually able to care for themselves, but they may have some slowing, chorea, and occasional losses of balance. It isn't too early to see a physical therapist to get ideas about exercise, or you can do things like aerobic exercise, walking, riding a stationary bike. Things that improve overall health and fitness will always help someone to walk better. Stretching exercises are important to keep muscles from getting tight. Strengthening exercises, particularly for muscles that are important for posture and keeping the body steady, and then specific balance exercises are important. Exercise can be fun. You don't have to do a boring program, do things that are fun. Take classes at the local gym like aerobics, dance, Tai Chi or Taekwondo, steppercise. Do fun activities with family and friends like hiking, golf, playing Wii games, things like Dance Dance Revolution, Wii bowling or regular bowling, Wii Fit, or using a treadmill or stationary bike. But be sure that the person would be safe in those activities before starting them. A problem for doing exercise programs in Huntington's is apathy and lack of motivation. This is part of the disease process and quite a challenge for the individual with Huntington's as well as the family and the neurologist treating them. Huntington's disease causes apathy, and it means that people have an inability to be motivated to do things that they enjoy. It can often be overcome, though, and most people with Huntington's disease will participate in activities or exercise programs once they get started. So it's just a matter of getting them going or getting them there to start doing it. Family can help by encouraging them to participate and by doing things with them. For earlier stage individuals, some advanced balance exercises would be walking sideways. And here, if I had a longer counter, I would walk back and forth sideways, side to side, standing on one leg. And to make it more challenging, you move or kick the opposite leg and walking backwards. As the disease progresses, balance becomes worse and falls typically become more common and more frequent. Balance exercises are more important at this stage and should be done by everyone. And physical therapists can be asked to come in and work with you on more advanced balance activities that may be required. Those activities may not be safe at home, and that's why they're better done with a physical therapist. Some activities at this stage that can be very beneficial would be practicing everyday tasks, things like standing up and down from a chair, reaching for high things and low things, going up and down stairs, and all of these things help train balance control during normal daily activities. As a person gets better with balance exercises, you need to make the exercises harder to do. So for example, in the standing balance exercise progression, first you work on standing with feet close together. When the person can do that well, then they can try standing on one leg. If they're very safe with that, it's time to make it a little harder. Add in moving the arm or the leg or turning the head side to side. And if that gets easy, and only if that gets easier, they could do something more difficult like standing on foam or on uneven ground and going on back to the exercises like walking sideways and backwards. And now I'm going to turn this over to Ann Kloos.
Hello, everyone. A fun and engaging way for people with Huntington's to do balance exercises is to have them play video games, such as Wii video games or the game Dance Dance Revolution. Dance Dance Revolution is a game in which the person has to step in different directions to the beat of the music. We actually conducted a study in 18 people with Huntington's, and we had them play the game Dance Dance Revolution for 45 minutes, 2 times a week for 6 weeks. And at the end of the study, we found that it did improve their balance and walking. And as well, the participants said that they really enjoyed playing the game. So playing video games may be a good way to motivate people with Huntington's to do balance exercises. Research has shown that people that walk slow and have uneven steps, such as people with Huntington's, are at a greater risk of falling. So it might be a good idea to have a person with Huntington's walk to the beat of a metronome that's set at a pace that's slightly faster than what they normally walk at to help them to improve their walking speed. Research doesn't support the use of music as an aid for training walking, although it was found to help people that have Parkinson's disease. Walking on a treadmill that's also set at a pace that's faster than what a person normally walks at might also be a way to help improve speed and variability of walking in people with Huntington's. However, it's not been tested specifically in people with Huntington's, but there was a study conducted in people with Parkinson, and they walked on a treadmill, and after a exercise program on the treadmill, they improved their speed, and also they had less variability in their steps. So it may be something that would help people with Huntington's. As Deb was talking about, some people with Huntington's fall because they are distracted and not concentrating on what they're doing. So what you can do is to help teach people with Huntington's that they do need to focus their attention on maintaining balance before they do a task in which they know their balance is going to be challenged. So if going up and down stairs is something that leads to falls, you would teach the person that they need to really focus on what they're doing and nothing else when they're doing that activity. It's also good, of course, to avoid doing more than one task at a time. And if a person has to do a very complex activity that's a sequence of activities like walking across the kitchen, opening the refrigerator door and getting food out of the refrigerator, and they're falling when they're doing this, you might try to break up those activities into simpler tasks and then have them focus their attention on each separate task. Another idea is to help people with Huntington's learn when they're getting fatigued so that they don't keep doing something so long that they're so tired that that then causes them to have falls. Many of our patients come in and say that they have fallen when they're either sitting down in a chair or getting up from a chair. And the reason they often fall when they're sitting down is because they're not close enough to the chair before they go to sit down. So we teach the person to touch the chair before they sit down and turn so they know the chair is behind them and then sit down. If they're falling when they're standing up, you can teach them to put their hands on their knees and bend forward at their waist, making sure that they put their feet under their knees and then push up. It's also a very good idea to have people practice getting up and down from the floor in case that they do fall and need to be able to get up. You can improve the safety and prevent falls by changing the environment. So for instance, you want to make sure that there's not a lot of clutter in the house. There are no slippery surfaces somebody could slip on. There are not loose rugs that a person could catch their foot on and then fall. It's important to have good lighting so that a person knows where objects are and avoids stepping on them. And it's also good to remove anything that's sharp or breakable in case a person did fall, and you would not want to have them get injured. As Deb was saying also, when people are having difficulty, say, going up and down stairs, it's a good idea to install rails on the stairs that they can hold on to. And in the bathroom, this is an area where falls are very likely to occur because people have to get in and out of bathtubs or the slippery surfaces. So it's a good idea to install grab bars in the bathrooms, and you may want to have the person use a shower seat instead of having to stand up if their balance is not good. We always encourage people to walk for as long as they're able to. But if they begin to have problems with walking and their walking is not safe, they may think about using some equipment, such as wearing a helmet or elbow and knee protectors to protect themselves in case they do fall. It is also good to think about using walking devices, such as a four-wheeled walker with swivel wheels in the front that allow the person to turn the walker easily. If a person is having trouble using devices for walking, then human contact, such as the person just holding their arm, might be helpful. It's all very important that people with Huntington's wear shoes that will not make them more likely to fall. So we recommend that they wear shoes that have a a wide heel base because that will give them greater stability. It's not a good idea for them to wear high heels. A 1-inch heel height is recommended. They also should not have shoes that have thick soles or toe grips that they might catch and then lead to a fall. Some people benefit from using shoes that have high tops, like boots or high-top tennis shoes, because it gives them additional ankle support, and that can help them to balance better. If it's hard for a person to get shoes on and off, you can use shoes that have Velcro or elastic shoelaces to make it easier. In the later stages of Huntington's, they may need help with all of their activities, and there might be severe movement problems that limit their ability to stand and walk safely. Research has shown that falls are the primary reason that people with Huntington's go into nursing homes. Walking should continue as long as they're able to walk, even if it requires use of assistive devices or human help and assistance. Physical therapists at this stage can educate caregivers about safe ways to help people with Huntington's to stay mobile, and also recommend equipment and ways that they can prevent falls. And here is some mobility equipment that might help in the later stages. You see here a person that is using a wheelchair, and the wheelchair is set so that it's closer to the ground so that the person can put their feet on the floor and they can actually use then their feet to propel the wheelchair. Now, we do not recommend that people be put and using wheelchairs all the time if they do have the ability to walk. It's always preferable for a person to continue walking for as long as they can. One way that people that are having balance problems and perhaps falling can continue to walk without falling is to use a Mary walker. And these are often used when people go to into nursing homes. When it becomes difficult for a person to get up from a chair, caregivers can be taught how to help them. We have found that using gait belts can really help to make transfers a lot easier and safer. So the idea is for the caregiver to put the gait belt snugly around the person's waist, and then they can assist the person to stand while making sure that they're bending their knees and using their legs to help to lift the person rather than using their arms. If it's becoming very difficult for a caregiver to transfer someone, a physical therapist can teach you how to assist your family member with transfers. At later stages in Huntington, people may have problems with actually falling out of chairs or falling out of beds. And so for people with Huntington's that are having these types of problems, there are special chairs, such as the Broda chair, that are actually designed to help keep a person from falling out of a chair without having to restrain them. If a person's falling out of bed, one thing you could do is to put the mattress on the floor so that if they do fall out, they won't injure themselves. So what's next in terms of research? Well, I'm happy to tell you that there are ongoing studies in England to determine if gym or home-based exercise programs will improve balance and walking in people with Huntington's. And based on our findings with the Dance Dance Revolution study, we feel that larger studies of video game-based exercise programs are warranted. We also think that studies on the effects of treadmill training in people with Huntington are needed.
And now we're ready for questions.
As a reminder, to ask a question, just type your question into the panel and hit send.
So we have one question, and that is, how do you get the Huntington's disease person to go to an exercise program if they don't want to? And I'll let Ann chime in as she wants to. I know that a couple of our families have said that they just cheerfully, one, they go together, and two, they try not to give a yes-no choice. And they say, all right, it's time for us to go, and put on your coat, and let's go do our exercise program. And they've reported that if the person will go, then once they get there, they do a great job and they enjoy it, and they always say they want to go back. We do have a few patients in our clinic who just won't go and just won't do that. And I tend to refer them back to Dr. Kostick. Do you have any ideas, Ann?
The other thing I think is helpful is that if you incorporate the exercise somehow into their daily routine. So for instance, just make it, okay, a certain time of the day, it's time for them to go for a walk. And you try to set a certain time every day, and that just becomes just part of their regular routine. And I think they're more accepting. They may still give you a lot of grief about it, but they may, just get into the habit that that's part of what they normally do.
Okay, I think I see another one. Oh, many physical therapists don't really know the inherent problems of balance with a Huntington's disease patient. They try to fit the Huntington's disease patient into their standardized, regular run-of-the-mill PT programs. What are your feelings about individuals that specifically, I'm sorry, the question's moving on me. Feelings about individuals that specifically focus on balance rather than physical therapy. Any ideas of names and places in Orange County, California of individuals that work with balance problems? I know that's a big challenge. It's a challenge for us here. I think that if you contact Huntington's disease centers, places like ours are best able to refer you to a physical therapist that generally works with individuals with movement disorders and might be better at making individualized programs, because we do encounter that problem. It is certainly out there that people aren't familiar with Huntington's and don't know how to do treatments that are most effective. I tend to advise people with Huntington's also to look for therapists that work a lot with Parkinson's disease, because they're so close together that they're going to be an individual that's more likely to know what to do.
Another recommendation is that there are physical therapists who have taken additional training and have taken a test to become certified as neurologic physical therapy specialists. So if you can, I would ask, and you can, there is a database on the American Physical Therapy Association website of these neuro specialists that you could look at to see if there's any in your area, or ask a physical therapist if they know someone who is a specialist.
This question seems to go along the same lines, that many people, physical therapists, don't know what to do, or that there's not anything to do for the chorea. And I think our answer before pretty much addressed that, don't you, Ann? Mm-hmm. The specialists will do better with that. If someone sends you away because they don't think they can do anything and you think they could do better, then I would say you should try someone else. Don't be afraid to. The question is, any advice on how to get the Huntington's disease patient to hold the railing on a stairway? And I know that's probably a very big problem between, one, their impulsiveness and their lack of insight into the fact that they need to hold the railing, and then two, the motor problems they have where just keeping a hold on the railing is difficult.
I think it takes a lot of repetition of cueing them, when you're with them and they're going to go up and down the stairs, just cueing them, hold on to the railing, lots and lots of repetitions, and then just, telling them that, if they don't hold on, they're more likely they could fall and get injured, and if they did, they, might lose some of their function. So I think you have to do a lot of repetition, lots and lots of cueing.
So, for instance, would you recommend then that somebody, since you're saying that actually going up and down stairs is not a bad exercise, to incorporate that into a daily exercise that, okay, today we're going to go up the stairs and down the stairs 5 times and hold on to the rail the whole way, and just do that, say, every other day? And it may take a long time, like a week or 2, but that repetition is what you're looking for.
Yes, the practice with the repetition, that's a great idea, doing it. And we would recommend every day. If you're trying to change a habit, doing it every day. And if you could make sure they never went up and down the stairs without you cueing them for several weeks, yeah, we laugh. We know that's impossible, but it would be better. The other thing I would incorporate in that repetition that Ann was alluding to is a cue, a simple cue, kind of like our touch, turn, sit. It would be always ask them, what do you do? Grab the rail. And then saying, grab the rail, so that, that right as they hit the stairs, the first thing they do is stop, think, grab the rail. Is there any link with long exercise walks causing temporary episode of incontinence? It is certainly very possible that an individual who became highly fatigued from walking could then have incontinence, because the muscles that help us stay continent, our pelvic floor muscles, are part of the kind of abdominal and postural control muscles and are activated with walking. And so if they got fatigued from walking, then a person could become incontinent. If the incontinence is not happening immediately after the fall or the walking, and it's happening later on or going on longer, then I think you should talk to a doctor about that. That I can't speak to. But muscle fatigue certainly could lead to an episode of incontinence. One way to help with that would for sure be to always go to the bathroom before going for a walk. What standardized balance tests do you find most helpful with Huntington's disease evaluations?
We use a variety of different tests. We do tests such as the Romberg test, where a person stands with their feet close together, with their feet in tandem, and then also one-legged stance, where they're standing on one leg. And then we also do tests that look at their mobility and how they balance when they're moving. And so one of the tests that we use is the Tinetti balance test, mobility test. And this looks at both balance and gait, or walking in people with Huntington's. And there are, other balance evaluations that have been used in Huntington, such as the Berg, the timed up and go test. These are, again, tests. They look at a variety of different balance activities. And there's a test called the 4-square step test, where they have to step over sticks on the floor and do it in a certain sequence, and you time how fast they do that. These are some of the tests that we are used most often?
The next question is, do we have any other game suggestions? Any game that gets the person up on their feet and moving, we're probably going to like it, as long as they're safe at it. I have a 80-year-old Parkinson's patient that does kickboxing, and she says she doesn't kick anybody, so I'm good with that. But any of the Wii Fitness, the new Connect games, it's getting people up and moving and challenging their balance and having fun, so they'll do it more. That's important. Have you had a problem with Medicare Part B covering physical therapy? No, we've never heard any problems with that whatsoever.
One of the problems, though, is that they'll only cover it for a period of
Oh,
time.
yeah.
And so after, usually I think the maximum is 6 weeks. And it's clear that, at least it's clear to me, that a lot of individuals would benefit from ongoing continuous therapy. And that's what we've had most difficulty with, is getting people to have continued therapy beyond the 6 weeks.
Yeah, Medicare is never going to pay for ongoing. It's only supposed to rehabilitate a person back better. One of the benefits we've had is involving community people in educating them. So we have some personal trainers in the community that run exercise groups that are a little more well-trained to do that with individuals with disabilities. My husband with Huntington's disease is an avid walker. Walking in the winter is difficult. Do you recommend yak tracks, those items you secure to your tennis shoes for better traction, or other ideas? I think that one would require an individualized assessment, because many patients with Huntington's, when they have something on their feet that grips the ground, will catch that, and then that will trip them and make them fall forward. On the other hand, the really slippery surface is another challenge. So I think that would be one where I would look at being individualized about what their problem was and how they responded. They may well try walking sticks. Some of our individuals in our clinic do well with walking sticks, and they can use the poles. We also, a lot of people seem to like the hand-carved ones. But if you're talking really slippery or snowy climate, then the poles with the pokey things would be good too. Pokey things. Here's one for you, Ann. Do you find that weighted vests may decrease chorea?
All right. Well, they haven't done any studies specifically looking at what, the use of weighted vests in people with Huntington's. But in people that have cerebellar problems, where they have a lot of tremor of their trunk, they have used weighted vests, and they have found that it can be beneficial in terms of just making the person more stable with less, trunk movement forward and backward. So I think that if you, apply the weights in a manner that, will help them to get, better co-contraction in their muscles, better stability in terms of their movements, I think that it possibly could improve their balance and gait.
The only thing we do is we really monitor weight loss when we do those weighted vests, because they are going to be making the person essentially lift weights all day long. And so thinking about how long they need to wear them, and is this a person who's at risk of losing too much weight, and keeping an eye on that. And Jane, I believe that's all of our questions, and we have certainly enjoyed doing the presentation today. So let us know if there are any others, but otherwise I think we're, that looks to be all of them.
That is great. Well, thank you so much to all of you for presenting, and anyone, if you have any last-minute questions, this is the time to ask them. We do have a few minutes left, but if not, thank you so much. And again, for anyone who wants to look at the slides again or watch this, these slides will be available in about a week. So if you do want them, that's great. And if there are no other questions, thank you, everybody.
There's one more, Jane. I'll grab it real quick. They asked about swimming, water walking exercises, and it's not a good choice. And we don't have any research to give us an answer about that, but I certainly think, especially in individuals where doing exercise on the land is not as safe, that the water walking is wonderful and the swimming is good. And if the person enjoys that, then that's what they should do, because they're going to be more interested and have more fun with it. And then I think that's it.
Great. Well, thank you so much to you, Dr. Kostick, Dr. Kloos, and Dr. Kegelmeyer, and to everyone for attending.